All right. Hi, everyone. My name is Tim McMahon. I'm the Director of Marketing here at St. Joseph Hospital. And today, on this episode of our Facebook Live broadcast, I'm here with Dr. Harris from the Radiation Center of Greater Nashua. So, thank you, Dr. Harris, for joining us today.
Thank you.
We'll be talking, as we've mentioned, about radiation treatment for breast cancer. And Dr. Harris is certainly our expert today. So, to start things off, Dr. Harris, could you give us a quick bio about yourself a little bit?
So I'm Dr. Steve Harris. I serve as the medical director at the Radiation Center of Greater Nashua. I've been in the position for 6 or 7 years and at the center for about 12 years. For those who don't know, the Radiation Center of Greater Nashua is a freestanding medical clinic at Exit 8 here in Nashua. It is the sole provider of radiation services for the Greater Nashua medical community. It is a consortium between the three major healthcare entities in Nashua. So St. Joseph's Hospital, Southern New Hampshire Medical Center, and Dartmouth Health.
Great. So just to be clear, so the radiation center, that's where we send all of our patients who need radiation treatment.
That's correct.
Okay, great. So can you tell us a little bit about why somebody would go to the radiation center? What kind of services would they get there? What kind of conditions are treated?
Yeah, so our job is to evaluate patients in conjunction with other cancer specialists, medical oncology, surgery. Typically, patients would be referred to us by one of those specialists. Nearly all of the patients we see already have a cancer diagnosis, and so our job is to evaluate them and then determine whether there's a role for radiation treatment, how it should be done, how much should be done, and so on.
Great, great, thank you. And do people only come to you through referral from their provider, from their oncologist, or can people just self-refer? Can they call you and say, I want to come to the radiation center for my treatment?
Yeah, we basically only take referrals from other specialists.
Okay, great.
Oh,
Sorry about that, folks. Quick interruption, but moving forward. So again, Radiation Center for Greater Nashua, people come to you just through referrals from three major hospitals in the Southern New Hampshire area. And so let's talk more about what radiation means. What is, you know, someone goes sees their oncologist and they say you need radiation. What does that really mean? What's the process? What does that look like?
Yeah, so we are targeting tumor areas with high energy X-rays to try to kill cancer cells. And there are a lot of different roles for radiation treatment. Obviously, it depends on which disease we're treating, goals of treatment, and whatnot.
Okay. And I mean, when you're looking at radiation treatment, I mean, I think there's been some recent advances, but traditionally, was it like is it a long process? Is it a short process? Is it very dependent on the cancer?
It's definitely dependent on the cancer diagnosis and stage. Um, Historically, most courses of radiation therapy have taken many weeks, 5, 6, sometimes 8 or 9 weeks. Probably one of the biggest trends in our field in the last 10 years or so is something called hypofractionation, where we use a lot of research and technical advances to shorten treatment courses.
So what is it that resulted in treatment taking so many weeks?
Well, to deliver radiation treatment safely and effectively, it's important to use relatively small amounts every day. That allows us to kill cancer cells, but then also helps minimize the negative impacts on normal cells and gives them time to recover from the treatment.
So help me understand. So what is this new hypofragmentation? What does that do that speeds up the process?
So in most instances, especially, so breast cancer would be a great example. We actually give more treatment each day than we had in the past. And so that allows us to shorten the entirety of the treatment course. And of course, this has been heavily studied, especially in breast cancer. It's at least as effective as some of the older regimens and has a lot of potential advantages, namely less treatment time.
Now, I think sometimes people hear the word radiation, right, and they're instant concern about, well, doesn't radiation cause cancer? Doesn't, because we hear about, getting an X-ray, and could that cause cancer? Or, how much radiation is okay versus too much?
Right. And there's sort of two different ways to think about that. The concern in the general population is exposing millions of people to diagnostic X-rays and imaging, whether that's at the dentist's office or through medical-based imaging. That's separate from the issue with radiation therapy. We're treating cancer, so we're trying to kill cancer or reduce the chances of recurrence of cancer. Can the treatment that we give potentially cause cancer? It can. Fortunately, those instances are pretty rare. It's primarily due to the fact that a lot of our patients that we treat are older, so the risk is a lot less in older people. Also, our ability to target and direct the treatment really helps us limit the body exposure to radiation.
Great. Now, we have a lot of questions that we have to ask you to get through in the next 20 minutes. But, one of the questions, and one of, I think, the topics that we'd like to talk to you about today is about tattoo-free radiation therapy. And when I first heard about tattoo-free, I didn't really know what that meant because, did we previously give tattoo? How do people get tattoos
Right.
or marks? So obviously, as someone who has not been through breast cancer treatment, can you explain what that means? What typically people, what the previous treatment resulted in with tattoos, I guess, and marks.
Yep.
And what we do now to change that.
Yeah, so the historical standard for delivering radiation therapy for virtually all body sites, but breast cancer specifically, involved us placing permanent ink tattoo marks on patients' skin. That was necessary because it allows us to properly align the treatment area with the treatment machine. And it's been the standard of care for decades, 50 years plus, millions of people treated that way. It was safe and reliable. Obviously, one of the downsides is those are permanent ink marks.
Sure.
So, if you start thinking about breast cancer patients in specific, many of them are diagnosed with early stage cancer, thankfully, and so many of them are ultimately cured from their cancer. So we start thinking about ways to minimize the potential long-term impacts of the treatment in that patient population. And so one of those is, do they want to have a permanent reminder of their treatment, the tattoos?
Sure.
So there's always been interest in trying to get away from that. And the question is, we still need to do the treatment safely. So how do we do it?
Yep.
Recent advances have allowed us to use other technology other than just ink on skin to avoid using tattoos, but still deliver the treatment safely.
That's great. So that is how new is that technology?
The technology's been commercially available for approximately 10 years. It's obviously improved and evolved over time. This idea of doing tattoo-free radiation, especially for breast cancer, is still being adopted. I would say it's not widely used in the U.S. right now, but increasing interest in use.
And how long have we been using it at the Radiation Center of Greater Nashua?
So we acquired the technology upgrades that we needed just earlier this year, and we've started doing tattoo-free treatments for breast cancer earlier this year. And it's, we use a special type of imaging system that allows us to visualize and track the surface of the patient's skin.
Yep.
While they're laying in the treatment position. The software allows us to verify that they're in the exact position. We can also monitor them during treatment with sub-millimeter accuracy.
Wow.
So yeah, the technology is unbelievable. It's also an added bonus that the technology that we use doesn't involve ionizing radiation. So it's imaging, but it's not adding any additional risk in that way.
Huh. Absolutely interesting. So is there any risk, any downfall to this new type of treatment?
Not really. once you feel comfortable with the setup, get some experience doing it, it's awesome. I mean, the technology is really unbelievable. Patients, although historically patients were should I say tolerant of having the tattoos because they understood it was a necessary part of the process and safe treatment. Now being able to do it without it, it's like a whole new world in that way.
And does it? And maybe you said this, but does it shorten appointment times as well?
It can. Yeah. So the setups using this software and this surface visualization are typically very quick.
Well, that's great. That's great. Well, thank you very much. So that was great. A great description of this treatment and certainly what the radiation center can offer. We do have some questions.
Sure.
So coming through here, and one person asked, after receiving this new form of radiation treatment, can someone drive home on their own, or do they need someone to pick them up?
There are no restrictions on driving after radiation treatment. Basically, you should feel the same when you leave the clinic after your treatment as you did when you came in.
Okay. So it's not like surgery where you get the anesthesia and it's just you come in. How long did you say a typical appointment might take?
Our treatment appointment times are 15 minutes, assuming we're on schedule, which we usually are. You come in, you get treated, and you leave.
That's fantastic. So we had another person just, looks like they shared with us a video about surface-guided tattoo-free technology, so thank you. We have a bunch of other questions that we've received over the course of the last week or so, people asking regarding breast cancer treatment or radiation treatment. And so I'll just kind of go through some of those and you can kind of answer them as they come through here. So let's see here. One of the questions is, are there any studies of the patient's heart after treatment using your technology?
Yeah, so one thing we haven't really even touched on yet is, in addition to using this technology for tattoo-free treatment, we also have implemented it as a way of decreasing the dose to the heart from radiation treatment. So this applies to patients with left-sided breast cancer. The heart sits right underneath the left breast. So when designing the treatment, we need to come up with ways to minimize or limit the radiation dose to the heart. We have quite a few ways of doing that. We have the ability to shape the radiation beam. So we literally block the heart out of the beam. Even in that scenario, though, you can get something called scatter. So radiation actually bounces off the patient themselves and goes towards the heart.
Gotcha.
You can minimize that effect, though, by increasing the distance from where the beam is to the heart. And so that there's a few different ways of doing that. The one that we use and is commonly used is something called a deep inspiration breath hold technique, or DIBH. This technology, the surface monitoring that we use for tattoo-free, is also used to help us monitor patients while they're taking a deep breath and being treated.
Great. All right, another question is, has the approach you use been shown to avoid extra X-ray images?
Yeah, so historically we would verify treatment setups by taking a series of X-ray images every day, every 3 days, every 5 days, whatever we think is appropriate. With the ability to monitor treatment before each treatment and during each treatment, that really increases our confidence level that the treatments are set up the way that they need to be. And as I said before, this new technology that we use, the surface monitoring, does not involve ionizing radiation. So that's definitely a perk.
Yeah, absolutely. So let's talk more about during treatment. How will one person asked, how will my position be monitored during my treatment?
Yeah, so the special camera technology sees the patient's surface. And so we know what position they were in when we plan the treatments, and then we want to recreate that when we're doing the treatments. And so the technology, the software that interfaces with these cameras knows what it's looking for and can see changes during treatment. So if you move, we know about it, we can stop the treatment. For this DIVH on the left side, if the breath you've taken is not deep enough or is too deep, we know about that as well.
Now, during treatment, will anything be touching the patient?
Nothing. Yeah,
Nothing.
these special cameras just look at the patient and
Wow.
and seize them, if you will.
Wow, that's amazing.
Yeah.
Let's see. We got a few more questions here. One person asked, "How can I be sure that my radiation is being accurately delivered?"
Well, from the patient perspective, there's not much that they can do about it other than, listen to us talk about some of these technologies.
Yeah.
We talk about these during consultation as well. And even when patients are on treatment, obviously they're there every day. They're working with their
Right.
therapy staff. They see the technology, and our therapy staff's very good about, explaining what's going on, what's this do, what's that do.
Sure, that's great. So, Dr. Harris, I mean, we've gone through a number of questions that our patients and our folks who are watching today have asked. You've given us some great insight into what the radiation center does and the types of treatment we offer. Is there anything else you'd like to add to this conversation?
Well, I would just say, in general, thinking about breast cancer management and the role of radiation and the radiation center specifically, it's important for patients to understand it's very much a multidisciplinary and collaborative effort. So that applies really to all malignancies, but I think maybe breast cancer is the best example. So, if it starts at a mammogram, which it does for most patients, so that's at your PCP, and then imaging with radiology, and then if there's an abnormality, a biopsy, and then a surgeon, and then pathology, medical oncology, radiation oncology.
Yeah.
And so, it truly allows us all to participate, to add our expertise to the care. And we meet regularly, to discuss the patients that have recently been diagnosed and to discuss treatment options, with all of the involved providers, as well as often in those meetings, there'll be consultants from some of the major hospitals, Boston or Leahy or Dartmouth,
Yep.
Who can add additional insight into new options that are sometimes available for patients, or even clinical trials that they could be eligible for. So it's really a collaborative, multidisciplinary disease, perhaps more or a better example than any other.
Yeah. Well, I think, from our perspective at the hospital, I think we often hear people say that, when they're diagnosed with breast cancer or any type of cancer, really, their instant perception is they have to go down to Boston. They have to go somewhere else to get, the best treatment, the best technology. And the reality is we have the best treatment and the best technology right here in Nashua, right here in southern New Hampshire. And especially I think when you're going through these treatments, if you're someone who has breast cancer and you have to get radiation treatment, you don't want to have to drive an hour for, as you said, a 15-minute appointment.
Right. And you don't need to. Breast cancer is a common disease, so anyone trained in oncology has a pretty good understanding of how to manage it. These technologies and these multidisciplinary meetings are things that we have available here. We've even had patients from Massachusetts and patients who've been seen at some of the Boston hospitals who sought us out, due to convenience and reputation, as well as this new availability of mark-free or tattoo-free radiation treatment.
Yeah, so I think that's huge. And again, I think it's just so important to remind folks that, the Cancer Center team here at St. Joe's, the oncologists here, in partnership with the Radiation Center, it's one big family, and like I said, it's very collaborative, and we all work closely together.
Yeah.
To provide the best outcomes for our patients.
Yeah, and I think to build on that, because we are freestanding by ourselves at Exit 8, I think the patients can get the perception that maybe we're not involved in the care, or we're disconnected from each other, right. But that's not true at all. The doctors at our center have been attending the tumor boards that have been put on here at St. Joseph's for forever.
Right.
And so we know all the oncology physicians that practice here very well and have for a long time and have a great relationship.
That's wonderful. That's wonderful. Well, I will, we're at the 20-minute mark, so I will wrap us up, but I will mention that one of our guests just added that Dr. Harris and the team at the Radiation Center are wonderful.
Thanks,
So-
Judy.
So thank you, Judy, for adding that comment. But again, for everyone watching, thank you for joining us today. Thank you for your questions. Certainly, if you have more questions, you're welcome to keep adding them into the comment section, and we can always reach out to Dr. Harris and his team later to get responses for you. But again, I think this was really insightful. It's really important to us to educate our community about what's out there and the opportunities to, as we say, keep care local. So thank you again. Appreciate your time. And thank you, everyone else.
Thanks.
And we will see you next time. So have a wonderful rest of your afternoon.